everybody, Rachel here. Today I'm asking the question, what exactly is a public health emergency? It might seem like a silly question right now since we're definitely living through one, but it's still a good question to ask. You know that old saw about pornography that goes, "I'll know it when I see it"? In some ways, you could say the same thing about a public health emergency. Some things just are public health emergencies. No one who lived through the bubonic plague pandemic, known as the Black Death, could doubt that they were living through a public health emergency, though of course they wouldn't have called it that. And we're just as obviously living through one now, with COVID-19 spreading all over the world, infecting millions and killing hundreds of thousands of people. So, a sudden outbreak of an infectious disease, that's the definition of a public health emergency, right? Well, it's actually a good deal more complicated than that. Infectious diseases have caused problems for humanity for thousands of years, and as soon as we started settling down with the development of agriculture, we started getting epidemics of those diseases. Remember, as I talked about in the smallpox video, an epidemic is the sudden increase in the number of cases of a disease in a certain area over what is normally expected for that area. You might think that cities, especially, used to be just cesspools of disease, and, well, you'd be right, but not all of those diseases were around constantly. Bubonic plague, for instance, would sweep through an area, infect most people, until everyone either died or recovered, and then the infection would die out, until everyone with that hard-won immunity wasn't there anymore, and the plague would sweep through the area again. Of course, diseases don't exactly respect our human national borders. They don't care if you're French or German, or Chinese or Korean. They'll infect you just the same. And for most of human history, the international community wasn't exactly much of a community, and it wasn't often up for working together to try to prevent these epidemics from happening or from crossing borders. But in the first half of the 19th century, several cholera epidemics swept across much of Europe and much of the world, with especially deadly ones in 1830 and 1847. I'll get into cholera in another video, but briefly, it's a bacterial infection that causes extremely severe diarrhea, leading to death in up to 50% of cases. Really, these were pandemics, since they spread from Central Asia through Russia to the rest of Europe, and even the Americas and Japan. Most countries did try to prevent cholera from crossing their borders, but cross them the bacteria did. These outbreaks made it apparent that there was a need for international cooperation in the field of public health. So, in 1851, the French government organized the first International Sanitary Conference to try to standardize quarantine regulations against cholera, plague, and yellow fever. 12 countries participated in 1851, but many of them, especially the British, were vocally against the use of quarantine measures against cholera. Quarantines, as we're learning firsthand right now, have negative impacts on trade and the economy. Draft international sanitary regulations were drawn up at this conference, with several countries signing them, and similar conferences were held every so often, but it wasn't until 1892 that the first International Sanitary Convention dealing with cholera was formally adopted. Partly as a result of the eventual success of these international sanitary conferences, other multinational organizations were founded to try to combat infectious diseases, such as the Pan American Sanitary Bureau and the Health Organization of the League of Nations. Then, when the United Nations was founded after World War II, it in turn formed the World Health Organization, which is the organization that is currently responsible for international public health. In 1946, the World Health Organization became the first specialized agency of the United Nations to which every member subscribed, indicating how important the countries of the world consider the topic of public health. Before I get into what the World Health Organization considers a public health emergency, I want to talk about how it's defined in the United States, because for better or for worse, the United States has an oversized effect on the rest of the world in this topic, as in many others. In the U.S., a public health emergency can be declared by either the federal government or one of the states or territories, or even a local government. For a federal declaration, the Secretary of the Department of Health and Human Services, as of the time of this filming, Alex Azar, under Section 319 of the Public Health Service Act of 1944, declares that a disease or disorder presents a public health emergency, or that a public health emergency, including significant outbreaks of infectious disease or bioterrorist attacks, otherwise exists. As you can see, we've already expanded our definition of a public health emergency, such as it is, to include other things besides infectious diseases. Declarations of public health emergencies at the federal level are fairly common, and in 2019, none of them were for an infectious disease. 3 of them were for the results of weather, hurricanes and typhoons. 1 was for the California wildfires, and the last was for the opioid crisis. Public health emergencies can also be declared for other types of natural disasters, such as earthquakes, tornadoes, tsunamis, extreme heat, floods, volcanoes, landslides and mudslides, and winter weather, and also for bioterrorism, chemical or radiation emergencies or mass casualty, and of course for epidemics and pandemics. The declaration of a public health emergency gives the Secretary broad powers, many of them financial, such as accessing no-year funds appropriated to the Public Health Emergency Fund, waiving or modifying certain Medicare, Medicaid, CHIP, and HIPAA requirements, and enabling the CDC to access the Infectious Disease Rapid Response Reserve Fund. A declaration also gives the Department of Health and Human Services the power to conduct or support investigations into the cause, treatment, or prevention of the disease or disorder, and also to temporarily reassign state and local personnel. It's also supposed to allow state and local governments to access the General Services Administration Federal Supply Schedule when using federal grant funds. The declaration of a public health emergency by the Secretary of the Department of Health and Human Services is not the same thing as a presidential declaration of an emergency or a disaster. You might see one or the other happening, or first one and then the other. For instance, Secretary Azar declared a public health emergency as a result of COVID-19 on January 31st, 2020, but President Trump didn't declare a national emergency until March 13th. As if that's not complicated enough, the 50 states and the territories of the United States can each declare their own public health emergencies, and there's really no consistency across the jurisdictions. State laws vary in their definitions of emergency and disaster, with some of them providing no definition at all, leaving it completely up to whoever's governor at the time to determine what constitutes an emergency. Since most state laws provide public health emergency powers that allow governors and their top public health officials to take extraordinary legal actions that are typically unavailable without legislative approval, this inconsistency can cause problems. Once again, infectious diseases, as well as natural disasters and bioterrorism threats, don't care about state borders. Even if, as is usually the case, everyone involved is doing what they truly believe is in the best interests of the people in their state or territory, it's difficult to coordinate a response when all the states are doing different things. To make things even more complicated, on March 27, 2014, Massachusetts Governor Deval Patrick declared the state's opioid addiction crisis a public health emergency, the first time that one was declared for something other than an infectious disease, a natural disaster, or an act of terrorism. This opened the door to further questions about public health emergencies. For instance, should widespread injuries, such as the opioid crisis, be considered public health emergencies? What about the increase in chronic health conditions, such as diabetes or Alzheimer's disease? The U.S. government and the public health community have not answered these questions yet. And that's just one country. Every country in the world has their own definitions and procedures for declaring and dealing with public health emergencies. And of course, we have the World Health Organization trying to coordinate all of this. In 1969, WHO adopted, revised, and consolidated the International Sanitary Regulations, renaming them the International Health Regulations. Due to their narrow scope, they really only dealt with cholera, plague, and yellow fever by this point. They were revised again in 2005 and they were entered into force generally on June 15, 2007. They're currently binding on 196 states parties, including all of the 194 member states of the World Health Organization. These new regulations allow the Director General of the World Health Organization to declare a public health emergency of international concern. Doing so implies that the situation is serious, sudden, unusual, or unexpected, carries implications for public health outside of the affected state's national borders, and may require immediate international action. Since 2007, the World Health Organization Director General has declared a public health emergency of international concern 6 times. The 2009 H1N1 influenza pandemic, the 2014 setbacks in the polio global eradication efforts, the 2014 West Africa Ebola epidemic, the 2016 Zika virus outbreaks, the 2018-2019 Kivu Ebola epidemic, and of course, the 2019-2020 COVID-19 pandemic. In contrast to national declarations of public health emergencies, a public health emergency of international concern is only declared for infectious diseases. The international health regulations are a set of legally binding rules surrounding infectious disease surveillance and outbreak reporting. Countries are required to report events of public health concern to WHO and to maintain 8 core public health capacities: national legislation, policy and financing, coordination and national focal point communications, surveillance, response, preparedness, risk communication, human resources, and laboratory. That all sounds good, but many countries simply don't have the capacity to do all these things. By the end of 2015, 127 of the 194 member states of the World Health Organization hadn't met all of them. And that's just for infectious diseases. There's no guarantee that natural disasters or bioterrorism would respect national borders either. As we're learning right now, public health emergencies can affect every aspect of our lives, and when they happen, they don't care who you are. As we're also learning right now, how we respond to public health emergencies can affect how badly they affect us. And that means having the capacity, understanding, and leadership necessary to respond appropriately. These are complicated issues, but public health emergencies are going to keep happening, and we need to put our efforts into making sure that our response to future ones is, well, better than this one. We can't forget the lessons that we're learning right now. I hope you enjoyed this video. If you did, and you think you'll be interested in more videos about public health, click like and subscribe. Thank you. I hope to see you soon.